CT abdomen and pelvis. Pre and post contrast. Clinical info. Known case of pangastritis plus hiatal hernia. Complaints of severe crampy pain in abdomen for 4 days associated with nausea, vomiting, 5 to 6 episodes, greenish in color, pallor and fatigue. Patient can swallow but vomits after 3 to 4 minutes. Technique. 2.0 mm reconstructed images from a scan performed on multi-slice CT scan. Reviewed on workstation using different window and level settings. Pre and post contrast CT scan abdomen and pelvis is performed according to departmental protocol. Findings. Stomach is partially distended with contrast and does not show any abnormality. Duodenum and duodenojejunal junction are normal as well. There is abnormal dilatation of jejunal and ileal loops having maximum caliber 4.0 cm. Transition of caliber is seen in terminal ileum, which is collapsed and appears strictured, narrowed. Cecum and ileocecal junction are collapsed and remains unremarkable. Appendix is retrocecal and prominent in caliber, however, there is no evidence of acute appendicitis or appendicular mass. Colon is predominantly collapsed. Fecal impaction of distal sigmoid colon and rectum is noted. There is associated mild pelvic ascites with thickening of pelvic peritoneum, mesenteric congestion and prominent but sub-centimeter mesenteric lymph nodes. Major abdominopelvic and omentomesenteric vessels are patent. There is no evidence of mesenteric ischemia. No pneumoperitoneum is seen. Liver is normal in size, has smooth margins and patent vasculature. There is no focal hepatic lesion, intra or extrahepatic bile duct dilatation. Mild periportal edema is seen. Gallbladder is normal without any radiopaque calculus or pericholecystic strandy changes. CBD is normal in caliber without any radiopaque calculus or biliary dilatation. Pancreas shows normal enhancement. There is no focal mass lesion, parapancreatic strandy changes or fluid collection. Spleen is normal in size showing normal enhancement. Adrenal glands are normal in size without definite nodule. Kidneys are normal in size and show normal enhancement. There is no radiopaque calculus, mass or hydronephrosis. Ureters are normal in caliber. Urinary bladder is well distended and does not show any abnormality. Uterus is not visualized, correlate with history of surgery. There is no adnexal, pelvic mass. Visualized lung bases are clear. Visualized osseous structures do not show any abnormality. Minimal body wall edema and fat stranding is seen. Impression. Small bowel obstruction with abnormal dilatation of jejunal and ileal loops having transition of caliber in terminal ileum, which appears narrowed, strictured and thick-walled. Associated mild abdominopelvic ascites, mesenteric congestion and mild thickening of pelvic peritoneum. No mesenteric, para-aortic lymphadenopathy or evidence of mesenteric ischemia. Differential would include obstruction due to terminal ileal stricture, likely inflammatory, or adhesion obstruction. No definite mass. Mild periportal edema in liver, correlate with LFTs.